Welcome back, everyone. Well, we continue talking about mental health and the stigma in the Black community during Black History Month. And back with us is Tiffany Williams-Brooks from the Harris Center, and we're going to talk about how culture and historical factors contribute to stigma and reluctance to actually seek care. And this is so important because the sad part about this is that, as I mentioned before, for those of you who missed, we're going to have the earlier interview we did as well. But we've got to talk about this because it is so critical.
Yeah.
A safe space to reveal personal information is often difficult for people. And how can we as individuals who may know somebody or realize that someone needs our help because of mental issues, what do we need to do to create those safe spaces and safe moments for them to reveal this or just to help them out?
Absolutely. So creating safe spaces is definitely important. What I often say, if you see your family member, such as a mother, grandmother, sister, wife, girlfriend, be okay with having those brave conversations with them. If you see that they're exhibiting symptoms that are prevalent in Black women, such as feelings of irritability, feelings of hopelessness, sadness, some of those physical symptoms such as fatigue, have those conversations and go in talking about the importance of being open about depression. It's scary sometimes to have those conversations, but it's important to create those safe spaces. I encourage workplaces, EAP programs, talk about seeking services for mental health because really the stigma is there. We've made so many strides to talk about mental health and mental illness, but it's important to talk about it with your loved ones. And they need to hear that from you, that it's okay to talk about it. Mental health is real.
And this is also an opportunity once that safe space has been created either by family members, by friends, or even the individual themselves. They can create their own safe space, right?
Yes, yes.
How do they go about doing that?
Yes, so I like to encourage support groups, maybe through churches, maybe through the workplaces. Sometimes having those support groups where women can collaborate with other women who are going through the same thing. Sometimes that brings in safety, being able to talk to others about the same thing that they're experiencing. That's really important.
And what other resources are available out there? I know your organization has a plethora of them. So how can people get a hold of you to get some of those resources?
So the Harris Center for Mental Health and IDD Services, we provide services to children, adolescents, and adults. They can contact us at 713-970-7000, or they can Google us at theharriscenter.org. We provide services such as cognitive behavioral therapy. We provide intake services. We have peer support groups as well.
I love that. Thank you so much. And a reminder that mental health or mental illness or anything dealing with your mental health is not an end. It's just the beginning.
Absolutely.
Okay. So
mental health is important. Thanks for having me.
Appreciate it. And we have a lot more still ahead.